That's usually more comfortable for the patient. Once again, what is our very first step? Make sure the patient is straight. Okay, so come to the head of the table, come to the foot of the table, doesn't matter. Just stand here, look straight down the patient. Do they look straight on the table?
Yes.
Okay, I also think so. I think they do look straight on the table. Okay. Once you have that, we're going to put a support underneath the ankles this time. Does that feel okay? So, patient is positioned, they're straight, there's a support, there's no rotation. So, what is next?
Make sure they're aligned.
Okay, so we're going to align our tube. So, in which directions do we need to align? Vertical?
Horizontal.
Horizontal, okay. Good, so we want to make sure that we're aligned laterally. Right? So, make sure we lock in up top. Where else do we need to align?
With the bucket.
With the bucky. So, laser, bucky, right? Right here at the dot. If it's not there, use the blue handle down here. Move this around until you are positioned. Okay. What else do you need to lock in?
That's like
Yes.
Good. SID, your height. Just bring this down, bring this down. Once you're in range, it's going to stop you. And now we are ready to position the patient. Here we are doing the same thing. We are going to center at the iliac crest. Bless you. So, iliac crest, right here on the sides. So, kind of feel for it, feel for it. This one is going to be a little bit tougher than the AP. Okay? So the crest is right there. If you have a tough time feeling for it, you can try and feel for the as-is towards the front. You can feel for those trochanters on the side. Okay? So this is the level of my iliac crest. And now I'm going to center the patient by floating the table. So now we're at iliac crest and we're here MSP. Is everyone okay with this so far? Okay. Prone is usually not as common. AP is preferred because AP reduces OID between kidneys and the IR. Okay, but if the patient can't lay on their back, you could always try to do these prone. Okay. Which marker are we going to use?
Left.
The left marker. How is it going to be placed? PA. Same projection as the patient. So in this case, we can just put the marker PA. Okay, with Amy, we actually do have a little bit of extra light on the sides here. So I'm just going to take the marker and place it right here inside that extra light. Okay? So this is clothing, right? So that's going to be okay.
How will we go for breathing as far as this positioning?
Okay, so for this position, breathing is exactly the same. So take a deep breath in, breathe out, hold it out, don't breathe, X-ray, and breathe normally. Okay? Now, an important point to keep track or to make note of is breathing in, breathing out, and holding your breath out is very strange to patients. Like intuitively, chest makes sense. You breathe in and you hold your breath. That makes sense to people. But when you tell people to breathe out and hold the breath out and stop breathing, they can easily get confused. So while you are positioning, it is a very good idea to prepare them for your breathing instructions. So while I'm feeling for the crusts, while I'm lining up the table, I'll be talking to the patient and I'll tell them, in just a moment, I'll be telling you to take a deep breath in, blow it out, but then hold your breath out. Stop breathing after you breathe out. Does that make sense? Okay? I get their confirmation, I've gotten them ready and thinking about what my breathing instructions will be. So as soon as I'm done positioning, I can step back,